Imagine this. What if just one single minute, a mere 60 seconds in the middle of an ordinary day, could be the difference between spotting a silent breast change early or not noticing it until much later? What if something so small, so quick, so simple could literally help protect your life? Before we go any further, here's the disclaimer you'll always hear from me. This video is for educational purposes only and does not replace professional medical advice. Always consult your healthcare provider for personal guidance. Now stay with me, because here's the part most women never hear. Breast self-checks are only powerful when they're done the right way. And the truth is, many women have never actually been taught how to check properly. They do it randomly, too quickly, or only when something feels off. And by then, valuable time may have already slipped by. But here's the hopeful twist. This isn't complicated. It isn't time-consuming. And it definitely doesn't require medical training. In the next few minutes, you're going to learn a simple, clear, 60-second technique that helps you notice changes earlier, changes that deserve attention, changes that your doctor can evaluate, changes that should never be ignored. So take a breath. Stay with me, because what you're about to learn is one of the most important things you can do for your health, and it starts with just 1 minute. Most women don't realize this, but the earliest signs of breast changes aren't always dramatic. They don't arrive with sharp pain, bright red warnings, or anything that forces you to stop and pay attention. In fact, many of the most important early clues are almost whisper quiet, tiny shifts that blend into everyday life unless you truly know what your normal feels like. And that's exactly why self-checking matters, more now than ever. Breast tissue isn't a fixed, unchanging thing. It evolves with you, with age, with hormones, with weight gain or loss, with medication, with stress, with menopause, and even with how hydrated you are. A woman in her 20s, 40s, and 60s can have completely different textures, densities, and sensations. Which means this: if you're not regularly checking your breasts, you're learning your body too slowly, and changes can slip by too easily. Here's the part that raises the stakes. Medical research and real-life stories consistently show that many significant breast changes are first noticed not at a doctor's office, not during a scheduled screening, but by women themselves, during a quiet moment getting dressed, showering, or simply doing a quick self-check. That means you are often the very first line of awareness. Your eyes, your hands, your attention. But here's the catch, and the suspenseful truth. Many women think they're checking correctly, but they're not. Some press too lightly and miss deeper tissue. Others rush. Some only focus on one area. Some don't check consistently enough to notice patterns. And some wait for a dramatic symptom, something that really stands out, not realizing that the earliest, most critical signs are often subtle changes in texture, shape, or sensation. The real power of self-checking isn't in hunting for something scary. It's in building a relationship with your own body so that anything out of the ordinary becomes crystal clear. When you know you're normal, even the smallest shift feels different. And that awareness, that early, internal alarm, can make all the difference. So yes, this 60-second habit isn't just a routine. It's a form of self-protection, self-awareness, and self-advocacy. And the more familiar you become with your breast tissue, the harder it becomes for any meaningful change to hide. This is the part where the entire conversation shifts, where breast checking stops feeling like a chore, a fear, or a medical mystery, and starts feeling like something deeply empowering, something personal, something you can do with confidence, calmness, and clarity in just 60 seconds. Because breast awareness isn't about memorizing medical terminology or turning your bathroom into a clinic. It's about reconnecting with your own body in a way that many women, honestly, never learn to do. The full awareness method rests on 3 simple pillars: look, feel, and compare. 3 everyday words that transform what could be an overwhelming task into something intuitive and almost grounding. These pillars work together like a quiet 3-step rhythm your body already understands. When you layer them gently, one on top of the other, something powerful happens. You stop guessing, you stop assuming, and you begin noticing. And that noticing is what saves lives. Everything begins with the first pillar, look. And this is not a quick glance in a foggy mirror while you rush to start the day. This is a still moment, a moment where you breathe, settle your shoulders, and simply observe. Stand comfortably in front of the mirror with your arms resting by your sides. Allow your eyes to scan the natural lines, curves, and contours you may not have truly looked at in months or even years. You're not searching for flaws. You're not judging your body. You're just noticing what is. You look for anything that wasn't there before. A slight ripple in the skin, a tiny patch of dimpling, a shadow or area of redness that stands out, a nipple that suddenly shifts direction or pulls inward in a way it didn't before. None of these things automatically mean danger, they simply mean change. And change deserves attention. After this first visual scan, gently lift your arms overhead. This simple posture stretches the tissue and often reveals subtleties you can't see in a relaxed position. Maybe a line smooths out, or maybe a new one appears. Maybe the skin shifts evenly, or maybe one side behaves differently. These micro differences are why looking matters. They are early whispers the body gives long before symptoms ever appear. Once your visual awareness is clear, you move into the second pillar, feel. This is where your hands become your most trusted tool, not to diagnose but to understand. Using the soft pads of your 3 middle fingers, press with gentle firmness and small, circular movements. Glide across every area, over the top of the breast, underneath, along the sides, and especially into the outer upper region flowing toward the armpit, where important lymph nodes live. Explore in layers, first the surface, then the mid-layer, then deeper toward the ribcage. Think of it like getting to know the landscape of your own body. You're not hunting for lumps with panic. You're simply familiarizing yourself with what's normal for you so that anything new will stand out. And yes, sometimes your fingers may land on a firm spot, a thickened area, a little knot, or a tender patch you hadn't noticed before. That moment can cause a quick spike of worry, but take a breath. Many breast changes are harmless. Hormones, stress, exercise, monthly cycles, weight shifts, they all influence texture. Your job is not to label the sensation. Your job is to recognize it, remember it, and ask a healthcare professional to evaluate it if it's new, persistent, or concerning. The power is not in knowing what it is, but in knowing it's there. Then comes the final pillar, the one that women often skip without realizing how essential it is, compare. This step is deceptively simple and incredibly revealing. Place your hands back at your sides for a moment and look at both breasts together. They are not, and will never be, identical. They grow differently, sit differently, and respond differently. But here's the key. Whatever their differences have always been, those differences tend to stay consistent over time. When something suddenly breaks that pattern, the comparison makes it visible. Now use your hands again, this time repeating the exact same motions on each side. The same pressure, the same circles, the same pace. When both sides are checked the same way, you can feel the contrasts clearly. Maybe one side is naturally softer. Maybe the other tends to feel denser. That's fine. What you're paying attention to is anything that feels newly uneven, a texture or temperature difference, a swelling, a ridge, or a spot of discomfort that wasn't part of your usual normal. Comparison is what transforms confusion into awareness. It shows you when your body is whispering something you might have missed. And when you put all 3 pillars together, look, feel, and compare, the 60-second method becomes more than a routine. It becomes a habit of self-respect, a moment of responsibility, a quiet act of early protection. You're not trying to be a doctor. You're not diagnosing. You're giving yourself the chance to recognize changes early so that a professional can determine what they mean. This is the heart of the full awareness method. Not fear, not urgency, just clarity. A minute of your time, once a month, designed to empower you, inform you, and keep you connected to a part of your health that matters more than most people ever talk about. In 60 seconds, you reclaim ownership of your well-being, and that might be one of the most life-saving minutes you ever spend. Now that you know how to check, let's talk about something just as important: how to make this tiny, 60-second act a natural part of your life, something you do with the same ease as brushing your teeth or taking your vitamins. Because awareness only becomes powerful when it becomes consistent. The secret is to attach your self-check to something you already do. Maybe it's right after a warm shower when the steam softens the skin and the bathroom mirror is inches away. Maybe it's before you slip into your clothes for the day when your body is bare and your mind hasn't begun racing yet. Or maybe it's tied to a date, the first day of every month, the last day, or even the day you pay a bill or flip a calendar page. Choose a moment that already exists and let this ritual slide into place beside it. And remember, this is not a medical exam. This isn't meant to turn you into a detective who worries over every little detail. This is simply you getting familiar with yourself, noticing subtle changes the same way you notice when your hair falls differently or your joints feel a little stiff in the morning. You're building a relationship with your body 1 minute at a time. When something feels new or uncertain, don't ignore it. Don't talk yourself out of it. Just write it down, a quick note on your phone, a date in your journal, a tiny voice memo reminding you what you felt or saw. Patterns matter. Time matters. And your future self will thank you for paying attention now. And if something doesn't settle, doesn't fade, or simply doesn't feel right, that's your signal to call your healthcare provider. Not to panic, not to assume the worst, just to ask an expert who has the tools to understand what your body is trying to say. With 1 quiet minute each month, you're not only watching for changes, you're protecting your future, strengthening your awareness, and taking control of your own story long before anything becomes serious. It's small, it's simple, and it might be one of the most powerful rituals you ever adopt. If you felt even a spark of clarity or strength during this video, don't let it fade. Tap like, hit subscribe, and stay close, because this channel is here to give you the kind of life-saving guidance every woman deserves but rarely hears. And if there's one thing you can do right now that might ripple far beyond your own life, it's this. Share this video. Send it to your daughter, your sister, your mother, your best friend who always says, "I'll check later." Because the truth is, most women don't realize how quickly 60 seconds can change their future. And sometimes all it takes is seeing a video like this once to start a habit that could save a life. Awareness is power, not fear, not panic. Awareness. That simple, sacred minute you give yourself each month is more than a routine. It's protection, it's prevention, it's partnership with your own body. So stay informed, stay connected, and stay aware. Because your future is worth far more than 60 seconds, and the knowledge you gain today might just be the reason you catch something early, act quickly, and write a healthier story for the years ahead. At the heart of this video is a simple truth. Your body speaks, but only you can learn its language. In just 60 seconds a month, you can build a habit that sharpens your awareness, strengthens your confidence, and helps you notice changes long before they become serious. This guide wasn't about fear, it was about empowerment. About knowing what to look for, trusting what you feel, and reaching out to your healthcare provider when something doesn't seem right. 1 minute, once a month. That's all it takes to stay connected, stay informed, and protect your health with presence and intention.